Hello, everyone, and welcome to our next online meeting, next webinar dedicated to the Exchanges Week 2019. And our today's webinar is going to be about social accountability and exchanges. How can we make our exchanges more socially accountable? Should we at all do it or not? And if we should, how exactly do we need to proceed with this process? So here today with the at the webinar, we have our lovely members. We have Katerina Dima, the liaison officer on medical education. She's from Greece. Hi, Katerina.
Hello, everyone.
Okay, we also have Katja Cic, the SCOF director, so the director on the Standing Committee on Public Health from Slovenia. Hi, Katja.
Hello, everyone.
And we also have Georgia Solda, the Scope External Development Assistant from Italy. Hi, Georgia.
Hello.
Okay, and can we go to the next slide, please, Georgia? So, what is social accountability? Why are we talking about it in the society? But before we get to answering those questions, I want to put some questions for you. So here on the slide, you can see them. And also, these questions are located in the chat on the right part of your screen, and you can always leave some answers for us. And when we get to this part in our webinar, we will also try to answer these questions. And we are expecting for some ideas from your side. Whatever ideas you have, feel free to write them down, and we will discuss if they're correct or if we have adjust them somehow a little bit more for our exchanges. So the questions are, why does society need exchanges? Should exchanges be accountable? If yes, then why? What it would add to the project of exchanges? What could an NMO do to make their exchanges accountable? What are the obstacles NMOs might face while adopting a socially accountable exchange program? What could IFMSA, so for example, other standing committees, do to help this process to develop? What is the difference between an exchange with and without accountability aspects? So keep those questions in mind and share your ideas with us. In the meantime, we can proceed to the next slide, and I'm giving a word to Katarina.
Hello, everyone. So we are going to begin by explaining what social accountability as a concept is. And this is a topic that we've discussed a lot in IFMSA, so I imagine most of you will have heard the term before or will be familiar with what it is. But social accountability, as defined by the World Health Organization back in 1991, is essentially the obligation that medical schools have to direct their three main activities, which is 1, education, 2, their research, and 3, their service activities, towards addressing the priority health concerns of the community or the region or even the country that they have a mandate to serve. So it implies that each medical school operates in a region and it is supposed to be serving a certain population living in this specific region. And all of its output should be guided by this principle. Now, what are the priority health concerns of the community? As you can see in the slide, is essentially defined by the main stakeholders of healthcare, such as the government, of course, the Ministry of Health, for example, or the Ministry of Education, since we're talking about medical education, the various healthcare organizations, such as hospitals or even NGOs, such as IFMSA, the health professionals themselves, and of course the public and the patients, who are the most important stakeholder. And social accountability is aiming to keep them at the forefront of these discussions. Can we go to the next slide, Tanya?
Georgia?
Thank you. Sorry, thank you. And okay. Social accountability is defined by 5 main values, and all of these definitions and these concepts, you can find them in one particular tool that IFMSA has created that we will be introducing later. I'm not going to give it up already. But the 5 values of social accountability are, in short, equity, quality, relevance, efficiency, or cost effectiveness. You may find it both ways. And then the 5th one is partnership. And this is tricky in the sense that sometimes it is included in the values, so you'll see them as 5, and sometimes we exclude it, so you might see them as 4, but here in IFMSA, we really value partnership and interprofessionalism, so we always include it. What do we mean when we say equity? We mean that everyone, regardless of their socioeconomic status, their culture, their background, their religion, they should have access to high quality healthcare and opportunities to access education. And this is very important. I think especially in medical schools, tend to be very difficult for students to reach, tend to be very expensive. So social accountability is governed by this principle that everyone should have the opportunity, should they wish to study medicine, to try and do this. Then we talk about the quality, both in terms of quality of education, so providing very high quality education to medical students, and thus producing the highest quality of health professionals. And we also talk about the quality of the health services in the health sector, such as the hospitals or the health centers. A lot of people, when they hear about social accountability, they might use the argument that it doesn't emphasize the quality, or putting the needs of the community first might actually even endanger the quality of the services. But that is, I would say, a myth, and it's not true, because social accountability aims to put quality in the middle of the discussion, and it's a very, very important factor. The third, and I would say most obvious point of social accountability, is relevance. So we need to be teaching students what is most relevant to their communities, to the patients that they will be expecting to see tomorrow when they graduate. So this is something important. We need to direct our curriculum towards those specific priority health needs that we mentioned right in the previous slide. And we need to be working together with them to identify them. So schools can't just be teaching whatever is most popular in the exam, or whatever is most popular in the big countries. Each country should define its own most relevant topics to address. Then the fourth one is efficiency, or as I mentioned, cost effectiveness. So what essentially it tells us is that we need to manage our resources intelligently, and we need to make the most out of them without overburdening the health systems and the education system, as they can be very, very costly. We need to be mindful. And of course, when you talk about partnerships, as I mentioned, we have a lot of different stakeholders in health and in healthcare, and we need to be bringing all of those into the table together. We need to make sure that they exchange, and that they even within education, they learn how to work together and how to work together efficiently. Interprofessional education is a very big component of social accountability, and it is given a lot of emphasis. So this is another example of how partnership is one of the 5 values of social accountability. And if you have any questions about this, feel free to leave them in the comments, and I'll provide you as much background as you would like.
Okay, thank you, Katarina. Now I would like to ask Katya if she wants to add something from public health perspective, maybe.
So as Katerina already explained very nicely, that social accountability is directed towards addressing the priority health concerns of communities, and that is basically what public health is all about. So that is why also in SCOF we feel that social accountability should be one of the values that we strive towards. And we feel that social accountability can also be very nicely implemented in the activities that we do as students, as well as in the activities that we direct towards the community, towards our nation, and even the region, if we are working towards that. I also think that within this webinar, but we will be talking about that a little bit later, we will be discussing the public health exchanges, but I wanted to also point out that together with SCOMI, SCOF has developed a toolkit on public health in medical curriculum, where also social accountability comes into play, since public health is one of the curricula subject that is still quite underdeveloped in many countries. And when we advocate for quality public health in curricula, social accountability should also definitely be mentioned there as well.
Okay, thank you, Katya. And I think we can move on with the webinar. Georgia? Okay, so now let's get closer to our topic, to the topic of our week overall. So social accountability and exchanges. How can we make exchanges more socially accountable? Georgia, would you like to start?
Yes, sure. So these are also the question we asked you. So if you are trying to answer this question, which is not that easy, you might try to find more specific answer to these more specific questions. First of all, I would like to start to think about why we need to make our exchanges more social accountable, why they should be social accountable. I think the most important factor is that too often students see the exchange as an easy and cheap holiday. And if the focus of us all is to make exchanges worth what they worth, if we go in the direction to make them more social accountable, also this risk can be avoided. So I think that to reach this, we need to give the students the opportunity to really learn what exchanges are about, and therefore to train our local officer, Lias and Loris, about the opportunity they can give the students to be to have a more social accountable experience. I think we have already few tools which are for outgoing students, the peri-departure training and the post-exchange debriefing, and for incoming students, the upon arrival training and the educational activities. I think both parts should be involved in this process. So when we speak about communities, we have to consider both the sending communities and the hosting one. And a student that takes part in an exchange, it's eventually part of both of them. So when it arrives on the country, hosting country, should explain him or her the needs of the community, how he can be relevant. And the perfect tools here are educational activities, and we are in fact trying to implement them. But of course, when he goes back home, that's the whole point of exchanges. He should try to take the knowledge as the skills he acquired on exchange back to his original community. So this is, I think, what we have. We have already the tools. We have just to work in the right direction and try to lead the exchanges, and when we promote exchanges, try to give this point of view. Yes, that's my point of view. Yeah.
Okay. Yeah, I just wanted to add from my own side that exactly what Georgia said, I definitely echo this. And Georgia was mentioning that during the pre-departure training and upon arrival training, we can address the needs of the society around, and it can go both ways. So, for example, during the pre-departure training, it would be really nice to address the needs of the society which the student actually live in. So, what are the problems? What are the main goals that and the main issues that we need to tackle in the healthcare of the current country? And then when the student comes to another country for exchange, it should be it would be very great if that local officer of that NMO and that local committee would address the needs of the society, of the local society. In this case, first of all, student would be able to compare what are the needs of the different societies and to compare what are the common things, what are the differences. Then during this, let's say, overview, students learns to actually define the basic needs of the society. So then, what else can be done? After this talk, after this discussion, it would be really great to define the basic goals of the exchange and the basic information that needs to be pointed out and learned by the student during the exchange. So let's say, for example, if a student living from country A, and in the country A, there are some problems with the, for example, let's say the ischemic disease of the cardiac ischemic disease, and it is a very common disease which is met in almost every patient in the country. And then the student is doing rotations, let's say in the surgical department. But so what? Yes, of course, student would be learning surgery, but also it would be very nice to tackle how the patients with the cardiac ischemic disease treated in that department and in that country. So what new can be done in medicine by other doctors in other countries, what is done differently, how it is done differently, and if this can be implemented in country A. So that this way, if this is the way of thinking, then we already can say that these exchanges are socially accountable, becoming more socially accountable that they would be if we would not think about those problems. And yeah, so then the educational activities also mentioned, of course, just training students on the way to see the diseases and to see the problems is also very, very important. And okay, so do we want to go to the obstacles that NMOs might face while adopting the social accountability exchange program, or do you girls have any other things to add to this part about how we can actually make the exchanges socially accountable? Okay, let me see if we have any answers. Unfortunately, not. Okay, then what are the obstacles that animals might face while adopting social accountability socially accountable exchange program? Well, first of all, it's not that easy. So you first need you first need to do the whole procedure. You need to create the plan of what exactly should be addressed during the pre-departure and during the upon arrival training. Secondly, since there are yet no trainings on social accountabilities in exchanges, I mean ready-made educational activities from our side, it would be nice to actually develop those trainings on your own. However, we can say that we will definitely be working in this direction from the side of Skopje and Skori. And the next question, what could IFMSA, for example, other standing committees to help this process? It's exactly something that I have already mentioned. So we already have some materials prepared by Skolmi and Skov on the topic, and Skopje and Skori will be working on the social accountability within exchanges directly. And what is the difference between an exchange with and without accountability aspects? Well, of course, we can always say that we are learning during the exchange, but then the question is, how relevant is our education during the exchanges to the actual situation in the country? Is it something we will be using, or is it something very, very irrelevant? And maybe here you can ask a question: why would we make a gap exchange then in this situation, the Global Action Project, which actually refers to the situation, to the actual situation in the community with a specific disease, which might not be even met in your community and in your country and local committee? And the answer is, the word is globalizing. We all know that there are a lot of people traveling around the world, and so do the diseases. So you never know if being a doctor in a society would you face the situation or not. I remember one of the doctors telling us a story during one of the lessons in the infectious diseases department when they had a patient with a very, very, very unknown disease to those doctors, so they couldn't recognize what was the infection they were facing with until they realized that that was a specific case of malaria, but not a very typical one, which is written in the textbooks. And it took them quite long to actually define and actually come up to the diagnosis. And yes, so it took some place from the treatment of the patient, and maybe if they would know how it looks like, and if they would have seen at least once how this type of malaria looks like, it would become easier for them to recognize it. So this is one of the examples. So whatever you learn, you just need to try to see the things that might be relevant to you in your future career as your future healthcare profession. And the most important thing is to actually respond to the needs of the patients, respond to their requests, maybe not even direct requests, to understand their cultural background and their specific maybe international so let's say national things, not international, yes, national traditions and things like that. And I think, girls, do you want to add something here as well?
Yeah, I wanted just to stress the importance of the collaboration between standing committees, which is also the point of this webinar today. Since, as Tanya and also Katya said, in the end, it's the aim of all of us, but there are standing committees who knows better because it's more of their focus. The topics that could be addressed to make exchanges social accountable. So the thing I want to say, it's an invitation to all the national and local officers to collaborate with each other, ask help to the other standing committees, because I think that in this way you can create educational activities, trainings and workshops that could be really high quality and could really help your students to really get to know the community and its diseases, its problems, the issues you want to tackle during the exchange, and eventually make the exchange relevant. And it's also what we are trying to do as ITs. So I think that if we all work together, in the end, we can make the exchanges program, which is really a big program and project within IFMSA, a better one, and we can still try to improve it. But this needs to be done by all of us. That's my opinion on it.
Yeah, I agree, and just wanted to add some one idea that can be an example. What can you specifically do in your NMOs and even local committees? Maybe it's better. Just try to come up with the list of topics that you need to address within your local society. And it can be a transforming manual that can be updated with every year by the local officers or even by the members of the local committees. And then just keep this document, and it will be a very, very good institutional memory. And besides, you would just do the things that would improve your exchanges. Okay.
And
So,
also to add to this, since we've been talking with IFMSA can do and is already doing, what Georgia mentioned is that collaborations are very much needed. An example of a good collaboration, how you can make exchanges more accountable and help exchange students to basically be a part of the process. Is that SCOF and SCOPI actually already developed an initiative that is called the Global Health in Exchanges Training, that introduces the exchange students to the concept of health systems that they're going to, so that way they can also already get the information that they need about the community they are going to be taking part of, and where they can get the basic information to help them make the exchange even more socially accountable.
yes, exactly. I absolutely agree with Katya. And besides those, public health exchanges usually learn us how to exactly we can define the needs of the communities.
Can I also add something?
Yeah, of course, Katarina.
I just wanted to add that social accountability is very interlinked with the concept of intercultural understanding, and what we try to do, for example, with PDT. So this is another factor that we should consider and why our exchanges should be socially accountable, because um, as Tanya said, a lot of people tend to think of the exchange month as something very easy that we do only for fun, but it's an incredible opportunity to meet a new community and to understand a new community. And social accountability in exchanges is trying to kind of bring this aspect a bit forward and more to the surface, because I think we forget about it a lot. So that essentially means meeting the patients, getting out there into the community health centers, encouraging our collaboration with the family medicine department or primary healthcare departments, because we do also have these exchanges and we have handbooks ready made for them. So it is an opportunity as well to encourage our students and encourage all the NEOs and LEOs to forge more partnerships with this particular departments, with this particular professors, and also helping out more in health outreach programs that our not local committees, that are each local hospital may have, or each university. So these are little things that we could try to work around to make exchanges more socially accountable. And I want just to stress that it is a very good tool to use to connect our students more with the exchange itself. and to make it an even more educational experience, apart from learning new diseases or learning about new conditions.
Okay, thank you, Katarina. And Georgia?
Yes, I wanted just to bring up another example. For those who are part of a European region, you know it already, but it was done another collaboration with SCOF and in January. In fact, in some NMOs, some educational activities about antimicrobial resistance were developed for incoming students, and we had successful examples. And of course, this is just another example how where standing committees can collaborate on very important topics, and how we have already done it. So it's not something completely new. And of course, it's also material it can be shared with you. So I just wanted to mention another experience we had about collaboration and trying to make our exchanges more socially accountable and our students more informed.
Okay. Yeah, thank you, Georgia. And I think at this point we can move on. In case you still have some questions towards what we have been explaining to you, please feel free to write them in the comments in the chat. Okay. And so what IFMSA does towards social accountability, let's now discuss this a little bit. So we gave you examples on what you can do, and now let's tell us what actually IFMSA does towards this topic. Katarina?
Yep, and I just want to point out that we have a few things on this slide, but there is actually a lot more that we do on the topic. And this has been social accountability was one of our global external focus areas back when we introduced them in 2016. It is a global priority now this year. Hopefully, it will be a global priority next year. So for the past 4 years, possibly even a little more, FMSA has been very, very engaged in this topic. I think the number one thing that I will have to mention on what we have done is the Social Accountability Toolkit. This is a free online platform that we have created and you can use. It offers a multitude of resources such as infographics, materials for campaigns, a video on what social accountability is, advocacy letters that you can send to the relevant stakeholders, and of course a very, very good assessment tool that you can use to evaluate your university on whether they are performing well in terms of social accountability or not. You can access it on the IFMSA website. Just Google IFMSA Social Accountability Toolkit and it will pop right up. And this was actually created together with one of our main externals, the Training for Health Equity Network, the NET, who are essentially a capacity builder organization for universities and health centers on social accountability. So you can do plenty of things with the toolkit. You can use it to give your own trainings. It has ready-made agendas and handout materials. You can use it for advocacy. You can use it for assessment. You can use it for all those 3 different things. Now, other things that we do about social accountability, of course, is international advocacy. So we attend external meetings on the topic. The main conference that happens every year is the TUF, TUFH conference, which usually takes place around August and September. And it brings together all of the experts in the area. We used for our advocacy our newly adopted last March meeting, not this year, last year, on social accountability in medical schools, which presents the official stance, the official position of the Federation on social accountability. And thanks to this policy document, we can go to meetings, we can talk to externals, and we can advocate, we can have a very strong opinion on why we think social accountability should be a principle guiding medical curricula. Since the August meeting in 2018, we've also created a workshop on social accountability, 3-day capacity building workshop, which includes a variety of topics in its agenda. We have submitted this proposal for the upcoming August meeting, but of course the decision has not been made on which workshops will indeed take place. And because we have actually done a lot of things on social accountability, back in 2017, we received a very important award from the Association of Medical Colleges of Canada, AFMC, which was the Sarah Bolen Social Accountability Award. It's one of the most important awards in the area, and it recognized all that IFMSA has been doing for social accountability in the past 4 years. It's been a short time, but we've had a lot of outcomes and very big outcomes, and we've managed to produce a lot of resources for you guys to use. And from now on, we will be working on creating new resources focused more specifically in the connection between social accountability and the IFMSA exchanges to also help you offset this efforts.
Okay, thank you, Katarina. Katya, do you want to also add something at this point?
As already mentioned, we also have the Public Health in Medical Curriculum toolkit that we're working on. We already mentioned the Global Health in Exchanges training that is a part, and also from the definition of what social accountability is, it correlates very, very nicely with the concept of universal health coverage as well, which is one of the global priorities of IFMSA and in SCOF. And also in Skopje, we've been working very much towards that as well. So basically, you can see that IFMSA has been working towards social accountability on multiple levels through multiple standing committees and different activities. So I can only echo Katerina that even though the time has been short, lots of things have been done that brought about great impact.
Okay, thank you very much, Katya. And I think that actually this information is kind of shaping up our webinar today a little bit. And let me just check the questions if we have some. Okay, and we have one question which is, can we get the link after the webinar? I assume it was about one of the materials that was mentioned, most likely the social accountability toolkit. And yes, we just want to mention that we will add the links in the description of the video, and you can find them below already in, let's say, a few hours or maybe tomorrow. So feel free to check the video once again, and you can find the materials in the description as well. And if you want to just go through the webinar later, again, before preparations for example, pre-departure training, you will be able to also use the materials according to how we were explaining this. And unfortunately, we don't have any extra questions, but do you want to add something? Georgia, Katya, Katerina?
I would like to add a small comment, if okay.
Sure, of course.
I wanted to point out that I understand that it's not always easy to see how we can make our exchanges socially accountable, but this is a discussion that we've taken up very recently in IFMSA, and already in the past year we've had a lot of ideas and we've had a lot of follow-up on the topic. So this is a journey that we're only just beginning, and any input, any involvement from the NEOs and the LEOs, or ideas from you guys on how we can make this a reality would be more than welcome. And I think more resources will be coming along the way, but I just wanted to remind everyone that we've had a little time working on specifically Scopy scoring and social accountability. But we've already done, I think, quite a lot of follow-up.
Yes, and this is besides also the work that is planned to be done. So we will keep working on the topic, and of course, we will keep you updated as well. Thank you, Katarina. Then I think, okay, we have a question about the achievement of social accountability. Would it be a problem? Oh, I'm sorry, just scrolled a little bit. So would it be a problem maybe that the exchange isn't held in the local language, but primarily in English? So as far as I understood, is like having an exchange in English, can it be an obstacle in case of achieving the social accountability in exchanges? Do you want to answer?
I can.
Yes, of course. Sure.
I think it is always sort of an obstacle in the sense that you can't directly very often you can't directly communicate with the patients. You will need an interpreter. So, there's always things that get lost in translation, but it's not something that can inhibit the way or inhibit the concept of social accountability and exchange. It's just a barrier that will always be there in mobility programs, and making them in only the local language will extremely limit the amount of people that can move from one country to the other, and then there will be a lot of countries that will have to be completely excluded because their language is only spoken in that particular place. Like, for example, this could happen for Greece. I'm saying this because I am from Greece. So I think it's a very valid barrier, but it's nothing that could stop social accountability from being implemented.
Yes, I agree with Katerina. Absolutely. Besides, for example, if you're working with a patient together with the student, and student maybe helps you, another student or a tutor helps you to translate your communication with the patient. Maybe even in this case, maybe even the tutor or student can add something and even like provide a broader view on the problem that you're discussing with the patient, so it can also be a little bit of a benefit, well, maybe not a direct benefit, but still, when you can just get a broader opinion on whatever is going on and whatever you're discussing. Okay, and I think we don't have any other questions so far. Okay, then just let me thank you all for attending this webinar. We hope you enjoyed it, and we hope that you got something useful from the webinar. I'll just want to add one little thing which might also be interesting for you. The more you try to make your exchanges socially accountable, the more the community is interested in your exchanges, and the more support you can get from the universities and the society as well, which may, as a consequence, lead to recognition of exchanges. And I know that we talk a lot about this problem. That's why I just wanted to mention it as a hint for you to think about. And I want to also thank Katya, Katerina, and Georgia for facilitating this webinar. Thank you, girls, very much for
Thank
your
you for
work.
inviting us.
Of course, how could we not?
Yeah,
Okay.
thank you, everyone. It was really great to be here with you, and we hope we can work together in the next term and next month on this topic. Thank you for being here with us.
Thank you for listening, and if you ever have any questions, don't be afraid to direct them towards us.
Yes, you can always email any one of us or approach us personally during the international meetings. So thank you. Have a nice night, evening, day, or morning, whatever part of the world you are now located in. And let's all work together towards developing of our exchanges and collaboration. Thank you and goodbye.
Bye.